I remember in med school, like doom scrolling and feeling very powerless about the world, and then thinking about effective giving, and at the same time thinking, who are these super rich, powerful people? They should be doing more. But then also learning that with a resident salary, I was already at the ninth percentile of global income. I was like, what? Like I earned 22 times the global median income in the US. So if not me, then who? And I thought, well, I can't give $1 billion. But then you find out, even $50 can prevent a child from going blind. That's actually really empowering. So instead of doom scrolling and feeling powerless, I can feel somewhat less powerless because I know that I could do a lot of good with a very small amount of money. And I thought, well, I'll donate money once my loans are paid and once I'm rich. And I think it's good to do that in the future too. But I think that there is always a time when we will get more financially stable. And eventually that's retirement. Oh, but you want to leave money for your kids. I think the time is now because now is when there will never be a time in the future where your money can go as far as it does right now. And even a very small amount of money can have a huge impact with the amount of inequality that there is in the world right now. My name's Ellery. I am a HEMONC fellow at Johns Hopkins in Baltimore. I read The Life You Can Save in high school, and there was a few things that stuck with me from the book, but I went to a really ritzy private school where my dad had been a math teacher. And so I always felt we were, solidly middle class, but I always felt like the poorest kid. I always looked at other kids and like, oh, they have more money than me. Like if anybody should be donating or something, it should be them. And so when I read the book, it first sort of showed me how lucky I was to be in my position. And since then, I've traveled around and going to other places, you're sort of struck by the level of poverty. And so I stopped feeling so bad for myself. But it was still hard to give money away. So that took a long time to realize that I could give away a small portion of my money and still live an extremely high quality of life. My mom is a social worker, and when I was growing up, her job was evaluating local charities. And it was clear that some of them were much better than others. And there were some that were pretty corrupt, and others, I remember there was one that worked on gun violence prevention that was really good and that had been studied and was so much better than this other one. And it was hard to convince the people who were allocating money that it should go to this one over that one. And that always seemed to be siloed in this area. But then when I heard about effective giving, which is essentially trying to tailor donations to the most effective charities, it just made so much sense. When I first came across the idea of effective giving, it was a little overwhelming because it's like, wow, such a small amount of money can do so much good. And then every time I'm at the supermarket, every decision can be, oh my gosh, I could buy the cheaper brand. And that the difference between the two is somebody's daily earnings, and it can have a huge impact on their life. I have a friend who's a doctor, and he told me he just decides at the beginning of the year what percent he's going to give away, and then just sort of thinks about his income as for him, it was 15% less. So he sort of makes the decision once and then lives his life without thinking about it too much on a daily basis and without agonizing over every little decision. And that made so much sense to me. I was like, great, I can sort of decide once and set some money aside, and then it'll be easy to go about my day-to-day life just living on that slightly smaller income. He works with addiction medicine and is a really great guy and does a lot of good directly, but he also has a huge impact through donations as well. I think it's really overwhelming to look at all the charities and try to figure out which one's the best. There are so many. I saw there's 1.8 million registered NGOs in the US alone. It's just absolutely overwhelming. But luckily, there are people whose job it is to evaluate charities and figure out which ones do more good than others and can help more people. And so GiveWell is one organization I really like that does that. And they have thousands of hours of research with really smart people, and they can vet charities and see what their actual impact is. And they recommend just a handful of charities, and it's mind blowing how much good every additional dollar can do for those charities. And for example, the Helen Keller Foundation distributes vitamin A, and I didn't realize how many children go blind because of vitamin A deficiency. For maybe $50, you can prevent a case of blindness at the higher end of what's estimated. I'm going to an Orioles game tonight. Like that's the price of a hat. And I think about how much I would give, to prevent my own child from being blind. And it's just, what wouldn't you give for a very small amount of money to prevent somebody else's child from going blind? It seems like a no-brainer. It seems like an amazing deal. And the world shouldn't be like that, where, I have so much more money than most other people, but that's the reality. I can't really just close my eyes. There's two main reasons to talk about it. I think one is that it helps build a cultural norm of giving. And then the other reason, which helps people, the end result is fewer people being blind or fewer children dying. So important. And the other reason to give is that it helps so much the people who give. I mean, it's so empowering to be able to do that. And I would like my friends and family to also have this experience. There's so many times in life where I feel disempowered reading the news, and I know that my friends and family also feel that way. So getting to share this with them, as people have shared it with me before, it's like, hey, you can actually do a ton of good for very little sacrifice. And when a lot of people hear about that, they kind of gravitate towards it kind of right away and want to hear more about effective charities and tell their friends. And so it's a win-win all around, but it starts with talking about it, and it feels like bragging. It feels a little cringy, but it's a must. I think for consistency with giving, it's important to talk about it, even though it's a little bit hard to talk about something like this because it feels like bragging, but just to make it, let people know that this is my intention. And then I also think it's reasonable to start small, or at least smaller, because it's really hard to do. And it's not, our society doesn't exactly preach this is what you should be doing with your money. And so it's hard to do. And when you hear about people who give away half their income or more, it feels intimidating. It's like, I can't do that, so this isn't for me. But there are also people who give away 1% or 5%. And I think starting out um, at a level that's comfortable for you is reasonable. And then every year it sort of feels like a challenge. Like, can I do a little bit more this year? And then you sort of build up. And if you take the giving pledge or you keep track somehow of what you've given, it can be pretty fulfilling to look back and see how much you've given away. So for our wedding registry, we asked people to give to the GiveWell General Fund, and we were hoping that people would take some time to learn about it when they're on their website. And a couple of people came up to me after and said they hadn't heard of this, and that they really hadn't thought that much about giving to this charity or that, and that they realized that a couple of the charities that they had been giving to, they're pretty good, but that they could be having a way bigger impact, and that they were grateful to have heard about it. So that made it totally worth it, and that was really good to hear. The Giving Pledge is awesome. It is a community of people who have all pledged to give away 10% or more of their income, and they to highly effective charities. And so taking the Giving Pledge and being public with your intention to donate this money away, it's a way of holding myself accountable. I think knowing how many people are also doing this can sort of help me realize that this should be the norm in terms of people giving away money. It's it's this amazing opportunity that so many people are taking advantage of, and I'm glad to be a part of that. I think that giving is sort of a muscle that you need to exercise, and it does feel like a big, or at least for me, it felt like a big sacrifice initially. I remember I gave away $100 the first time when I was like 18, and that was just so much money. I mean, I thought about lawns and everything. It's like, wow, that's so much. And then when I started earning an income, starting with 5% of my money, it just seemed enormous. But then I went through the year, and I'm like, I didn't really notice that money gone. It didn't, lower my quality of life at all. So, and it actually gave my life a lot of meaning that it didn't have before. And so I thought this is a great deal. It gives me fulfillment. I've been born in this situation where I can have a huge impact by giving away a small amount of my income, and it's a no-brainer. Of course, I want to do that. It's incredibly fulfilling, and it hasn't changed my quality of life at all. So giving games is a social and fun way to learn about charities. So the way it works is that a donor will give a certain amount of money per person, and that person will have the opportunity to give that money to one of several charities. And they'll have an opportunity in the beginning to sort of declare your intentions, like I think I'm going to give to charity A, and then you hear short presentations about the charities, and at the end you get to vote and allocate your money, and it will go to that charity. And these are, I think, really good opportunities to learn about different charities and to just take some time to think deeply about the level of evidence and the efficacy of different groups. Because when you go to these, at least I have been surprised at the charities because you hear about something at first and you're like, wow, that sounds pretty good. And something else, and you're like, does that really help? And then you see the pitch and you look at the data, and a lot of it's counterintuitive and surprising. And it's a good thing to think about. And by the end, where I've ended up giving the money in giving games, it always ends up changing, even though I don't expect it to. I think comparing charities seems taboo, and the giving game and this discussion asks you to compare charities, which may feel, at least for me, feels uncomfortable at first. But when you think about it, you realize that you can do so much more good with certain charities over others. And when I've talked to friends and when I've learned about this, I have felt surprised and empowered to hear how much good certain charities can do. And that sticks with you and is really meaningful. Doctors all rotate through pediatrics, and if you've ever gone through the pediatric oncology ward or other places, the NICU, if you see a child die, it is just, and seeing the parents, it's hard to forget. And you would do anything to help somebody in that situation. And when you're in that situation, you can't. I mean, you wish that you could, but you really can't help that person. But there are other people that you can help, which is an extraordinary part of our world where with a few clicks and a small amount of money, you can prevent something like that from happening by giving to the most effective charities. When I would give money to other charities that aren't doing that, it's like I'm leaving 99% of my impact on the table, or I'm missing the opportunity to help prevent that from happening. I think about mom in East Asia or wherever, or in sub-Saharan Africa, and they love their kids just as much as parents here love their kids. Yet a huge amount of them will lose a child. I try not to think about it because it's so awful. I have the ability to prevent something like that from happening. That is a crazy part of the world, and opportunity to prevent a lot of suffering. It's empowering to think about that, and it might be easier to just not think about that. Knowing that you can make a difference and prevent something so awful from happening is kind of a huge responsibility, but it's also just a fact of the world. It's an opportunity that I think people should take, and I think that once you do, you will feel pretty good about preventing something like that from happening. I do think it's natural to want to give locally. But if we really think that all people are created equal, then we'll think about where money can go to do the most good. How can we help the most people the most? So, put another way, if I'm giving away a portion of my income, I am not going to think about, or I hope not to think about, how can I help the most people who look like me or the most people that have the same religion as me, but how can I help the most people? That's it. And often those people live really far away, and they don't look like me and they don't have the same religion as me, but their parents love them just as much and their siblings love them just as much, and they're people. And if I could help a whole lot of them for the same cost of helping one person that lives in my community, I definitely want to do that. I think at high impact medicine, there are so many resources to help physicians do the most good that they can with their careers. And that it's just awesome to be able to take advantage of those resources and to learn from doctors who live all over the planet who share this goal, and to be part of that community. It is very inspiring and motivating, and has become part of how I think about my job on a day-to-day basis. And I'm really grateful to High Impact Medicine for welcoming me into this community and for providing all these resources. It just seems like a great opportunity to get to reach people who would be really interested. Doctors at their best are interested in helping others and in doing so as efficiently as possible, and triaging their time and at looking at evidence and at accepting new data. And so this group seems like the group that would be most passionate and interested in effective giving. Doctors also make relatively a lot of money, even if it doesn't always feel that way. And so they have an opportunity to help outside the hospital in ways that are extremely powerful. And I think when you think of doctors helping people in the developing world, at least I think of people moving there and working directly. And I think that's incredibly important work. And it's just not something that I want to do with my family. And I think that luckily you don't need to in order to have a giant impact. And I hope to share this with other doctors and let them know that you don't need to move to Afghanistan to have a huge direct impact. You can donate a portion of your money to the most effective charities, and you can have an equally important impact, even if it's really far away and even if it doesn't feel like that at first. Looking at the data and looking at what these organizations can do, you can have just as big of an impact by donating a portion of your income to the most effective charities. So I want to get that. A lot of people know this, but building community around these ideas and spreading the message about that. There are doctors practicing in poor countries that are brilliant, and they just don't have the resources they need to treat their patients. I mean, it's hard to imagine, a patient coming in for neutropenic fever, and we're like, well, I know how to treat this, but we don't have access to antibiotics and we don't have IV fluids. That would be so frustrating. And there are physicians in countries that have this problem 100 times a day and have to watch people die because they don't have access to the resources. But there are also charities that help provide these resources. And I think that we should, as doctors in richer countries, help with with a small portion of our income at least to help provide these resources. I keep track of how much I give because A, it helps me stay accountable to myself, and also because then I can sort of look back and feel proud. So I had my first donation was $100 in 2009, Population Services International, and I've given to a bunch of different charities over time. And they started to track the GiveWell charities in like 2015 or something like that, and I have it written down. I can look back and see that I made a difference, and I'm proud of myself for having done that. And I do not miss the extra money at all. I mean, there's no part of me that's like, man, I wish I hadn't given this money away in 2016 or something like that. When I started residency, I started giving away 5% of my salary, and I've worked my way up each year, and this year should be 20%. But it would have been very hard for me to go from 0 to 20, and I certainly hope to do more in the future. And so working my way up, I mean, for me at least, that was needed, and I hope I'm still working my way up, but it's hard. There are people who are such better people that are practicing medicine abroad that give away much more than me. There are people who donate organs and people who are really incredibly generous, and I super admire them, but I am not that person. But I don't think you have to be in order to have a big impact. Normal people can give away a portion of their salary and still live at a very high level. In terms of what I should be doing, it's probably so much more, but I have sort of come to terms with here is what I'm going to give away this year, and next year I'll try to be a little bit better, but I can also be proud of what I'm doing. If I could talk to myself in the past when I was giving money away, I would tell myself to look at the data and look at the recommendations, because you're doing good, but you could be doing, 50 or 100 times as much good. And that would be fewer funerals at the end of the day for children. So good job, but check out these opportunities. And for me in the future, I would say, I hope I don't forget that just how privileged I am. I mean, you see on the news billionaires and you think, oh my God, they're so much more privileged than me. But in the world that we live in, I have everything that I need and so much more. And I hope that I can remember that and to not forget how much good I could do. I think about like a religious person trying to convert people. Like I'm never offended when people try to save my soul, even though I'm not religious, because I'm like, man, you're trying to keep me from going to hell. Like that is a huge deal. How can you be so casual about it? I get that you're not casual about it. And this is just like, man, if you donate to better charities, there's going to be fewer dead kids. Like this is a great opportunity, very hard to talk about, but it's so important.